26 million Americans suffer from kidney disease, and another 20 million are at risk. 1 in 7 adult Americans has early stages of chronic kidney disease, and an additional 1 in 7 is at risk for diminished kidney function.
The wait to get a kidney right now in the United States is on average around 5 or 6 years. In California, it's anywhere from about 7 to 10 years, depending where you live. We simply don't have enough organs. Nationwide, we have about 500,000 people on dialysis right now. Of that, about 120,000 are on the wait list waiting for a kidney transplant. And those people are waiting years. And dialysis itself carries a risk, a real risk of mortality. There's about a 10% chance of dying each year you're on dialysis. If you're over 60 and diabetic, it's closer to 20% per year.
That is occurring in the face of what we think might be millions of potential donors who could literally save the lives of the persons now losing their lives if they were justly compensated for giving a kidney.
Over the last decade, 63,742 persons died or became too sick to transplant while waiting for a kidney. That means for every 1,000 U.S. patients receiving a life-saving kidney, 382 eligible persons died from circumstances potentially correctable by kidney transplantation. In 2015, over 13,000 people died or became too ill waiting for an organ. Over 100,000 kidneys were needed, with only 13,878 kidneys available for transplant.
Across the board, we're seeing more and more kidney failure. We're keeping patients alive longer, but people are living to develop more chronic conditions, and we need to do something to take care of that. We need to get people off dialysis.
In addition, the patient who gets a kidney transplant becomes, in many cases, a productive member of society, a working member of society, a tax-paying member of society, unlike most patients on dialysis who unfortunately are either too ill to work or cannot fit a work schedule around the dialysis treatments.
The transplant surgeons on the FAIR Foundation board and many others in the medical community believe that financial incentives will encourage more people to become organ donors.
While the FAIR Foundation has goals, objectives, policies regarding how governmental regulations can be changed in order to provide more organs for transplantation, the important thing medically is that the FAIR Foundation can see a way to save more American lives. As to how that's done exactly in terms of changing policy is up to legislators, is up to actually the public to weigh in. But the idea here is to save lives now needlessly lost.
You need public support to have anything occur in Congress. Along those lines, we've just completed a study in JAMA Surgery that actually looks at a national polling group surveyed of U.S. registered voters who are likely to vote again. Of that population, approximately 2/3 were both in favor of living donation and of a financial incentive, in that the financial incentive would make them more likely to donate.
As a 2-time liver transplant recipient, I feel that we need to redesign the transplant administration process. Financial incentives for organ donation would ease the shortage for organ donations and help save many, many lives.
We have plenty of people in this country who could safely donate a kidney. Unfortunately, altruism by itself hasn't been enough. So one idea that is being discussed more and more in the transplant community is the idea of financial incentives.
We think that a legislative relief to allow a pilot program to see if it would work would actually allow us to practice evidence-based medicine. That's what we do today.
Please tell our elected officials you're in favor of compensating living kidney donors, and express your support for a trial study of financial incentives to increase organ donation. Please contact the FAIR Foundation if you have questions or would like to contribute to our cause. Together we can change healthcare policy and make more organs available for transplant, saving hundreds of thousands of lives. Thank you.